Okay, great. So as people continue to join the webinar, I'm going to go ahead and get started. I'm Erica Rosser from the Johns Hopkins Bloomberg School of Public Health in Baltimore, Maryland, USA. And I am going to share my screen. Okay. And welcome you to our webinar, Food Insecurity, Hunger, Gender, and COVID-19. So this webinar is part of a larger project which began in early 2020 with the goal of understanding and mitigating differential gender effects of the COVID-19 outbreak. So for the past 2 years, our team of global partners from Bangladesh, Nigeria, Kenya, the DRC, Brazil, UK, China, and Hong Kong, and Canada have been undertaking a real-time global gender analysis of the effects of COVID-19 and government responses to provide evidence to inform public health responses. And our work has been supported by the Bill and Melinda Gates Foundation and the Canadian Institute for Health Research. So I encourage you to also visit our website. The link is here on the slide, and there you will also find a large number of relevant resources, including communication outputs, working papers, statements, briefs, blogs, and tools. I also invite you to join our Gender Working Group, which is a platform to share resources and ideas and look for collaborations. We have several hundred members from around the world, from across academia, civil society, multilateral organizations, and government. Everyone is welcome to join, and you can send a message through the website. The website, again, is here on this slide. And then I'm just going to take a minute to review a few quick housekeeping notes. So the event is being recorded and it will be available on the website after the webinar. You can type questions into the question and answer function. Please state your name and affiliation ahead of your question and your location. Please keep your questions brief so we can get to as many as possible. Don't worry about spelling. The art of contributing is valued more highly than the art of spelling. You're also welcome to ask questions anonymously. You should feel free to use the chat box to chat with other attendees, but try to make sure that your questions are asked to the Q&A function. Live closed captioning is available. You can turn that on by clicking the closed caption button at the bottom of the screen, and you can turn on subtitles or the live transcript. You can email us at genderandcovid@gmail.com with any follow-up questions or points. And you can also follow us on Twitter. So we have a couple of handles here that you can tag with any tweets about the event. Okay, and then I'm just going to take a minute to introduce our panelists. Today we will be hearing from Atonu Rabbani from the BRAC James P. Grant School of Public Health, Brunah Schall from the René Rachou Research Institute, Cecilia Fabrizio, Standing Together for Nutrition, the Micronutrient Forum. And then before we hear from our speakers, I would just like to open the webinar with a brief presentation on food security, gender, and COVID-19. So, simply put, food insecurity is lacking access to sufficient, safe, and nutritious food to meet dietary needs for a healthy life over time. In 2014, the UN began using the Food Insecurity Experience Scale, or FIES, which is a experience-based metric of food insecurity severity. They began using this to measure and compare prevalence rates across countries and populations. The scale includes 3 classifications: mild, moderate, and severe food insecurity. And for global monitoring, there are generally 2 thresholds that are used: moderate and severe. Yesterday, we published a new brief, Food Security and COVID-19, Intersectional Disparities and Dual Pandemics. And the link for that is here at the bottom of that screen. We use a gender lens to explore the hunger pandemic in the context of the COVID-19 pandemic. Because although global food insecurity is not a new issue, the COVID-19 disease control measures did contribute to millions more people experiencing food insecurity in 2020. In 2019, 2 billion people, or more than 1 in 4 of the global population, lacked regular access to nutritious and sufficient food or experienced hunger. 1 year later, that number had increased by 320 million. So by 2020, almost 1 in 3 people experienced moderate or severe food insecurity. Now, there are many external and internal drivers that impacted food systems and contributed to the sharp increase that we see in 2020. Among that, the measures that were implemented to control the spread of COVID-19, which led to food supply disruptions and loss of livelihood and financial support for a lot of people. So what are some of the risks? Well, when households are faced with food shortages, they tend to adopt certain behavioral strategies. Some of the shorter-term food consumption coping mechanisms that people may adopt to manage food shortages or unaffordability include rationing, eating less expensive food, or borrowing food. Examples of longer-term livelihood-based coping mechanisms that people may adopt in response to food insecurity are more related to spending, income, and assets. So that would include spending savings, borrowing money, taking on debt, begging, and accepting risky or exploitative work, including transactional sex and child marriage. Poor diet quality is also a risk factor in childhood disease and underdevelopment, diet-related non-communicable diseases, and all forms of malnutrition. So when we look at the data, we see regional inequalities in the distribution, concentration, and degree of food insecurity and hunger. Latin America and the Caribbean saw the sharpest increase in moderate or severe food insecurity from 2019 to 2020. And even in Northern America and Europe, where the lowest rates of food security are found, this region saw an increase in food insecurity prevalence for the first time since FIES data collection started. The number of undernourished people across almost all LMICs was 5 times more than the greatest increase in undernourishment this century. Also, globally and in every region worldwide, moderate or severe food insecurity prevalence is higher among women than men, and that gap was widened during the pandemic. Those impacts are also compounded among women with lower incomes, less education, and those living in suburbs of large cities. So why is there a gender gap? Well, one of the reasons is that women's livelihoods tend to be more vulnerable. More women work in the informal sector, which was heavily impacted by the pandemic. They also tended to be juggling the double burden of increased childcare demands in their households, which fell disproportionately to them. Agriculture was another heavily impacted sector during the pandemic, and it's a primary source of livelihood for most women living in least developed countries. There are also context-specific community and household level gender dynamics that contribute to household patterns in food consumption, which put women and girls in a position to eat least and last, and that's both in terms of food quantity and nutritional quality. And finally, during the pandemic, there were gender-based restrictions that further impeded women's movement and economic opportunities in certain countries. So what can we do? Well, the food systems that impact food security and nutrition outcomes are impacted by a complex web of interacting factors, and they're best viewed through a food systems lens. But to understand and address the underlying mechanisms that drive that disproportionate impact on women and girls, we also need to be applying a gender lens to questions of food security. This means, among other things, prioritizing the ethical and safe collection and analysis of multi-level intersectional disaggregated data to identify vulnerable subgroups experiencing hunger and malnutrition, and to plan and monitor food security policies, investments, and interventions. And finally, in our brief, we also include some gender-sensitive responses aimed at making food systems more inclusive and addressing the needs of women and girls who are disproportionately vulnerable in all dimensions of food insecurity, including reducing gender inequalities in food security and nutrition within households. So for example, who eats last, supporting structural changes like microfinancing and access to land tenure, that protect women's agricultural livelihood and rights to resources, and engaging meaningfully with women as stakeholders in food systems at all stages of response to food insecurity. So on that note, I am going to turn it over to our first speaker and welcome Atonu.
Thank you so much. I also have a presentation. Let me see if I can get it online. I hope you can see the slides. Erica? Okay. So thanks so much, and it's a pleasure being here. It's been more than 2 years now that we are coping with COVID-19 pandemic. So I think this is actually a good time to think about the experience that we have had, and also kind of how to look forward to address some of the issues that we have faced, especially in the context of food insecurity. And as the previous speaker, Erica, has already mentioned, but I think it's very nice to follow what we have listened so far, because some of the data that I'm going to present will put even more context to what we have heard so far. So at the onset, I should say that I'll share some results from a project that I've been involved with some of my colleagues, and Rosemary is here, so there are other people here in the panel. Over 1.5 years, we're looking at gendered experience of COVID-19 and its impact. Today I'll share some results from quantitative surveys carried out in 3 countries, Bangladesh, Nigeria, and Kenya. We have already published a paper, and some of the results that I'm going to show will build up on that paper, but it will, I hope it will be even richer, because we have more recent data over a panel. So we're going to see some trends for these 3 countries. And pandemic, I think needless to say, it has been very disruptive. In 2020, the global per capita GDP contracted by 4.3%. And I have also shared here results for findings for the 3 countries that I'll be focusing on. Only Bangladesh registered a positive, albeit a lower rate of growth. Nigeria is quite telling, because I didn't know that there was a kind of a recession going on over the last 5-6 years. There was a sense of recovery, but because of pandemic, it again came down to a negative, more than about 4% negative growth rate. Kenya was kind of average compared to the world, but then registered a negative growth rate. And as you can see, that COVID-19 comes in waves. So there are times when there are a lot more cases. So I think this is important, because our surveys also aim to track some of these cyclical movements, so to speak. So we had 3 rounds of data. First one in November 2020, then March and November 21. So we have kind of a year with we have data covering entire year. So for the structure questionnaire survey, we covered 3 countries. We have additional countries where we have qualitative analysis, qualitative explorations. Again, I'm echoing here. I think the reason that we should look at the impact of COVID by different groups. For example, if we just look at men as opposed to vis-a-vis women experience, industries that employ women more are worse affected. Caregiving responsibility also fall more within the household to the female member, and also loss of livelihoods among, there's a kind of differential impact. So our survey, there was a little differently sampled. In Bangladesh, we took advantage of a pre-COVID National Representative Nutrition Survey. So it's representative of adults in Bangladesh, and we drew sample from that. In Kenya and Nigeria, we did not have a sampling frame like the one that we had in Bangladesh. So we relied on random digit dialing. There's some bit more nuances, especially in Kenya. We had some additional samples, but I won't go into the detail. I think what is important for this presentation is I'm going to rely on a balanced panel. So all the results that I'm going to show over these three surveys come from individuals, respondents who are followed all three rounds. So in Bangladesh, we have 49%, about half women, female respondents. In Kenya and Nigeria, they're overrepresented. So the first results, food insecurity across these three countries, we have this binary outcome. In Bangladesh, in round one, in November, December in 2020, about 30%, 20 to 30% of the respondents say that they suffered from not having enough food or money to buy food. It came down a little bit over next 3 months, but then it kind of stayed at the same level. In Kenya and Nigeria, the level is much, much higher. Another interesting feature is female respondents almost always report a higher level of food insecurity. Now, we have different data, types of data. In this particular case, I'm showing how they coped up with the food insecurity. And this is also, again, echoes some of the narrative that we have already encountered. People rely on many different coping strategies. Less preferred food items. I'll actually elaborate a bit more on that. Borrowing food from friends, family, different sources. Interesting, and it's kind of similar in all three countries, but there's a little bit of divergence in this middle panel between Bangladesh and Nigeria and Kenya. But reducing food consumption was particularly high among the respondents in Kenya and Nigeria. In Bangladesh, still 20%, and it increased between round 2 and round 3, about 20%. But it's interesting, and it's important to notice that it's much higher in Kenya and Nigeria. I'll digress a little bit here. We're taking advantage of another survey that I've been involved with some other colleagues, where we looked at different types of food consumption. For example, staple, for example, mainly rice and protein. This is also an interesting panel where we followed RMG, ready-made garments apparel industry workers in Bangladesh. And they're like, it's about population of 3 million, so it's quite important for Bangladesh. And as you can see, that people relying, when it comes to sacrificing food items, people rely on protein more so than staple food such as rice. So there's also kind of a substitution away from the types of food that people probably should be eating. So there's a dietary diversity impact. It is also interesting to notice that if we ask, like, who is actually sacrificing within the household, and there's a clear gender gap. For staple, there's not much statistically significant difference, but when it comes to protein, the female respondents are reported sacrificing more than their male respondents. I think it's also interesting because all of them were involved with as a RMG worker. So regardless, even if we control for kind of like a similar type of occupation, female respondents, even if they're earning member of the family, they're sacrificing more. This is my last slide. So coming back to the survey that I've been talking about before, we looked at psychological well-being based on depression and anxiety. So food insecurity is strongly associated with a higher level of mental distress. In Bangladesh, it has been statistically significant, but the rate kind of the association went down, has come down a little bit, but in Kenya it went the other way. In Nigeria it kind of stayed 7, and it's 0 point. These are standard deviation gap, so these are substantial. So 0.26 standard deviation increase in distress, level of distress. So we should be kind of addressing the basic need of people. So my concluding remark of persistent food insecurity has been a very major, it's a major issue, and it has been going on. And now with a global, like worldwide higher level of inflation and ongoing conflict, I think we should continue focusing on this. Bangladesh fared a little bit better compared to Kenya and Nigeria, but obviously we should not generalize for the entire African continent. But this is in line with findings from other studies as well. Even in Bangladesh, structurally vulnerable group, for example, informal workers and especially women showed higher level of food insecurity. Female respondents are likely to report higher level of food insecurity, and they sacrifice consumption of desirable food groups, so to speak. Again, food insecurity is a major source of mental distress and detrimental impact on psychological welfare. So we should policy-wise, and we can discuss it further in the discussion session, that this is something we should be paying attention to. So over to you. Thank you so much.
Great, thank you, Atonu. It was really interesting to hear some of the findings coming out of Bangladesh, Kenya, and Nigeria. Please put any questions that you have for Atonu into the Q&A. And then we're going to hear now from Brunah, who's going to talk to us about some of the qualitative work that's been done in Brazil. Brunah, welcome.
Thank you, Erica. I will share my slides. Can you see? I'm trying to. Oh. Okay. So yeah. So thank you. I will be presenting the results of the research we did in Brazil from the Gender and COVID-19 project. So to begin, just a little bit of context. Here in Brazil, food insecurity is, even before the pandemic, it's marked by gender and race. I'm showing here just to illustrate a survey that was done in 2018 that showed that the risk of hunger and hunger are more prevalent in households in which the reference person is a woman and a person of color. And this pattern was still observed during the pandemic. And on top of the inequalities that we already had, the pandemic, like Erica and Atonu already said, impacted women.
Brunah, so sorry to interrupt you. Just your slides aren't full screen, so we can't quite see them.
For me, they are. This always happens. I don't know why. I'll try again. Or maybe if I can't, maybe I can ask Corey to help me. But I'll try once again. Did it work now?
No, still not quite full screen. Rosemary, would you be able to share Brunah's slides for us? And Brunah, maybe you can just ask Rosemary to move to the next slide when you're ready.
Okay. Sorry about that. I really don't know why.
Okay, thank you.
So I'm in the third slide now. Yeah. So these graphics are also they are in Portuguese, sorry, but they are just to illustrate the race and gender inequality. In the top, there is the difference by gender, male on the left and female on the right, and on the bottom by race, and brown, white, black, and indigenous and yellow people. So the pattern that was already observed before the pandemic of women and people of color being more affected by food insecurity was still observed during the pandemic. Next slide, please. So we did 49 semi-structured interviews with women from 2 urban communities, one in Belo Horizonte called Cabana do Pai Tomás, and one in São Paulo called Sapopema, and 2 rural communities in Vale do Jequitinhonha, Minas Gerais. Most of the women we interviewed identified as brown or black, and most of them were mothers. Only 7 did not have children. The age ranged from 21 to 64, and 41% of them have a monthly household income of less than 2 minimum wages. And almost a half of them did not receive the government financial emergency aid during the pandemic. Next, please. So in rural communities, I brought 2 quotes just to illustrate the biggest issue that we identified in rural communities. One is the lack of water, which is historical. They suffer from this violation of basic human rights for decades, and it has to do with structural racism. They are a Black community. And in the quote on the right, a woman is saying, you can't plant because at the time the flower blooms, which is for you to harvest the pumpkin, there is no water for you to water the plant. And then you see the plant die and you can't do anything because we can't take out drinking water too. We can't take out drinking water to water a plant. So they prioritize having water to drink so they don't have water enough to plant, which is their primary source of food is what they plant, and also it's their primary source of income. And also during the pandemic, sometimes the roads were closed, the city was closed, and without being able to plant, they depend on buying food from the market. And most of them depend on public transportation. So they suffer from not being able to go to the cities nearby because there is no market in the communities. They have to travel far to buy food. And during the pandemic, they struggle with the markets in the cities and no transportation. Next slide, please. In urban communities, women depended a lot of food handouts, but this quote on the left is showing that the food handouts don't have a variety of foods. They don't have a diet rich in vitamins and protein. It's always, it's always rice, beans, and flour. There are no other types of food that can compose a rich diet, which is also important. The woman is saying a diet rich in vitamins, minerals, proteins. So they complain about only receiving donation of the same types of food, like it's always rice, beans, flour, and pasta. On the right, there are 2 quotes to illustrate the coping mechanisms. The first woman is saying that she prioritized maintaining the quality of the food and reducing the quantity. So you used to buy a bunch of bananas today, you buy half a bunch, right? We reduce the quantity, but we are trying to maintain the quality of the food. And another woman from São Paulo, Sapopemba, she prioritized the quantity instead of the quality. Thank God we didn't run out of food, but the quality decreased a lot because we had to choose more affordable food to be able to maintain our livelihood. And next slide, please. We also asked women to evaluate the government action during the pandemic related to food insecurity. And we asked them to evaluate the federal, state, and municipality government. And the federal government was the most criticized. This quote on the left, a woman say, I saw an article in which the president, Bolsonaro, was saying that in Brazil, no one went hungry, that this conversation was a lie. I wanted so much for a few moments to pass in front of him and say, where did you see this? Take a walk with me and you change your conception. And then you see the neglect, right? So our president said this on the news that it was fake news that we had hunger here in Brazil, and this shows the lack of the neglect from the governor, especially from the federal government, because it's not only the impact of the pandemic; it's also a political issue here in Brazil. From 2016, we are having several public policies are being destructed. And so now we have very few public policies that target this issue. And on the right, a woman is complaining of all the spheres and powers, and that the government doesn't see that food insecurity is an important factor in the fight against inequality in general. And another woman is saying that the state and federal government left population to God. The third sector had a bigger role than the government here to donate food. But she says that the municipality at least does something. Here in Belo Horizonte, the municipality did a lot of food donations. Next slide, please. We also asked about solidarity networks, and we saw that most of them are led by women. Women are important leaders in these communities. And in the brief we published, we highlighted the story of three of them: Miriam from São Paulo, Sapopemba, Lúcia is from Belo Horizonte, Cabana do Pai Tomás, and Maria Aparecida is from Córrego do Rocha in Jequitinhonha. And these women, they have a lot of knowledge about their own communities. They know how to find people that need the most help. They know what needs to be done. So we highlight the importance of doing partnerships with this leadership of the government, doing partnerships with these women in order to create and evaluate public policy. Next slide, please. So after we published this brief, we sent it through WhatsApp, and some policymakers reached us and asked us to present our research in a Human Rights Commission here in Belo Horizonte. And as a result of this presentation, some policymakers did a technical visit to Cabana do Pai Tomás. This picture is a picture of this meeting, which was very important to identify the gaps in public policy, because we have a lot of public policies on paper, but in practice they don't reach the people effectively. So it is important to have this kind of meetings and to talk with women that are leaders in order to understand how the policies can be implemented in a more dialogical way, not because they are being implemented from the top bottom, not listening to what people really need. So we highlight the importance of being this bridge between the women from the communities we are doing research and the policymakers. That's it. Thank you. Obrigada em português.
Great, thank you, Brunah. It's always interesting to see data come to life through qualitative findings. So now we will hear from our final speaker, Cecilia Fabrizio. Cecilia, welcome.
Thank you, Erica. Can you see my screen?
Yes.
Great. My name is Cecilia Fabrizio, and I'm the program lead for the Standing Together for Nutrition Consortium. I have dark hair glasses, and I'm sitting in my home office in upstate New York in the US. Today, I'm presenting an analytic framework for understanding the pathways that are driving COVID-19 to create a disproportionate impact on women and girls' nutrition. I'll share how we developed the framework, the key findings, and how it can be used for developing policies and programs to mitigate the impact of COVID on nutrition. We developed the framework starting with a look at the COVID shocks that really came from the secondary impacts of COVID. So the pandemic lockdowns and the containment measures created 4 compounding crises. We conducted a living review. Evidence about COVID is just coming out, like some of the research presented here, as well as there's evidence in the past from Ebola or say the 2007-8 economic shocks. So we conducted this living review looking at the data that existed. We applied a gender matrix analysis to make sure we're incorporating the critical elements that are relevant in this domain. And then we made sure we incorporated and aligned with key frameworks that already exist, such as UNICEF's or the Gender Transformative Framework. These 4 shocks, again, caused by really the secondary impacts of COVID, were a loss of income, the economic impact, food system disruptions, health service disruptions, and then school closures. This is a very complicated piece of our framework, just focusing on the school closure component of it. But I wanted to show the evidence behind this that builds on a lot of the work out there. So if you start on the left in the purple box, we have that first COVID shock around school closures. Then looking at the green boxes, this came out of our gender matrix analysis. So the key elements that are important here from a gender perspective. The red boxes show how they disproportionately affected elements. And then the blue are the nutritional impacts. So increased anemia, poor birth outcomes, stunting, and wasting. Ultimately, the intergenerational effect. I go through that quickly because this is an easier way to look at it. When we go through this framework, we see that how gender power relations exacerbated the shocks. And the 4 areas again, women and girls tended to be more economically vulnerable, ended up less likely to eat nutritious food. They had limited ability to seek care for themselves or their family. And girls were under pressure for child marriage and adolescent pregnancy. Going through each of those in a little more detail, again, this builds on work that's presented earlier in this webinar. Women really bore the brunt of the economic and the social fallout from COVID-19. An additional 47 million women and girls were forecast to sink into poverty during the COVID period. A lot of this is because many women are employed in the informal sector, and women experience job losses up to 1.8 times higher than men did, particularly in low and middle income countries. So of course, if you're an informal worker, you have limited worker protections. You are less likely, you're paid less, you're less likely to have resources to fall back on, like loans or saleable assets, and you'd have less legal and social protection. Women also took on more unpaid work at home, which again limited their time to seek work outside of the house. Food insecurity rose rapidly during the pandemic, impacting women and girls diet quality, and malnutrition the most. So COVID-19 dramatically increased the number of people who couldn't afford a healthy diet. And it's estimated it's at least 50% of the global population. So as discussed, households cope by slashing spending on food, especially healthy foods, like animal source foods or fruits and vegetables. And due to social and cultural norms, women often eat last and least, so that they're buffering the impact of food insecurity on their family, but they're the first to suffer from malnutrition. In health services, COVID-19 overwhelmed health systems and they restricted mobility, so particularly for women and girls. Health services are, of course, a crucial delivery channel for nutrition services. So when services closed or transport shut down, it really impacted access. UNICEF estimated that access was reduced by 30 to even 70% during the height of the lockdowns. Gender power relations and social norms further limited access. Women lacked decision-making ability to direct care for themselves or their family. And perhaps it was worse when they lost income, the ability to bring income into the family. They had a higher burden of unpaid care, so less time to seek care, and increased household poverty, limited funds for transportation. School closures, I showed you in more detail. The finding is the impact on it. The longer schools are closed, the more likely that girls will not return. So this increases their risk for child marriage and adolescent pregnancies and long-term loss of human capital. So in many countries, schools were closed for at least a year, in some countries for as long as 2 years. Girls took on essential family roles. Now we have households that are already struggling with poverty and food insecurity. So gendered expectations further increase pressure for child marriage. UNICEF had estimated that up to 10 million more girls are at risk of becoming child brides. Adolescent pregnancies lead to lower birth weight babies and higher risk of death for the mothers and the babies. You put this together, I have a very small box that shows what it all looks like with this, but the simpler version gives you a sense of how they impact each other and how interrelated they are. And I would particularly highlight how poverty impacts the others, increases food insecurity, puts more pressure for child marriage, and reduces access to health services. This analytic framework can be used to drive systematic change. It can be used as an advocacy or an implementation tool. So while health and nutrition interventions can have positive effects, if it doesn't take account of these gender power relations, they won't be as effective. We know that sometimes gender power relations can appear tangential to the desired health outcomes, and sometimes they can be difficult to identify, measure, or address. Gender norms, of course, are embedded in society. But without addressing these underlying changes and the underlying causes which led to the inequities in the first place, you're not going to see sustained change. So we recommend following similar process through this pathway as we've done. Standing Together prioritizes moving from evidence, such as this analytic framework, to policy advocacy. Policy and programs must be gender sensitive and gender responsive in their design, scope, and delivery. So we recommend these key policy actions. In the area of economics, get cash to women, provide cash transfers targeted to women, extend social protection to women, increase access and employment benefits, support women returning to work with targeted actions, credit, training. In the area of food insecurity, again, nutrition programs must reach vulnerable women and children. So ensure that there's resilient coverage of essential nutrition programs and that social protection programs are targeted and focused on nutrition. In the area of health services, when there are shutdowns, it's important to identify those gaps and address them and address any other barriers to access for health services. Women who are pregnant are particularly vulnerable to the impact of reductions in lack of access to health services on their nutrition. For girls, if school closures happen, continue nutrition education, perhaps at the community level, And then work on developing programs to incentivize girls to return to school. And maybe it's also programs that target their families. Investments now will have tangible impact in the future. We must prioritize women and girls, particularly the most vulnerable. This will boost the reach and effectiveness of COVID-19 recovery and build resilience for future shocks. I want to gratefully acknowledge the contributions of my collaborators listed here and the generous funding from the Government of Canada. Thank you.
Great, thank you so much for that, Cecilia. I have to say it was interesting to sort of hear so much of what was echoed across the 3 different presentations from the different countries and at a more systems level. So we do have some questions that have come in, so we can move on to the question and answer session. I'll start with one that I will address to all 3 panelists. So based on your results, what do you think are some of the long-term implications of food insecurity? Why don't we start with, we'll go backwards, so we'll start with Cecilia.
I think that's a great question. We're very concerned that we now have this cohort of women and children that the COVID impacted them during the first 1,000 days of their life. And so the food insecurity and more importantly, the malnutrition impact will affect and limit their human capital, their development ongoing, and it'll have a multi-generational effect.
And then to Brunah, same question.
Yes, I agree with Cecilia. There is a long-term effect, and also, as Atonu said, there is we saw a high impact in mental health in women, especially mothers who are the ones that suffer the most in seeing their children suffer from food insecurity. Yeah, I think that's it.
And Atonu.
Thanks. So I'll start from something that Cecilia mentioned about malnutrition, stunting, which has kind of long-term impact. And if anything, those are used as an index of long-term impact or an outcome of malnutrition, especially undernutrition. I would just like to add that because of different social norms, there's a clear hierarchy of who sacrifices within a household. So if I just stylize, for example, if it is a nucleus family of father, mother, and a son and a daughter, it's typically mother, then the daughter, then son, then possibly the male earning member of the family. So, so if the daughters are suffering or bearing the additional burden of food insecurity coming from, stemming from, say, pandemic, that there is a clear gender intergenerational impact. And there's also persistence of that norm that actually kind of comes back generation after generation. Another thing that Cecilia mentioned, and I really would like to highlight, is girls dropping out from schools and then marrying early. In the context of Bangladesh, it is definitely, Bangladesh is regarded as one of the success story in different social indicators, but early child marriage actually remains a big problem in Bangladesh. And there are some studies which have highlighted the fact, not only in Bangladesh, also in other countries within our neighborhood, that girls are married off earlier, even in addition to a level which was pretty bad to begin with. And that has a huge implication intergenerationally. If girls are married off early, they bear children earlier, and that has a lot of implication intergenerationally in the long run. So I'll stop there. I'm sure, I mean, if we go back to the framework that we have seen just a little while ago, there are also different other pathways by which we can try to answer this question. So it's a great question, and I'm glad that we already have a framework to kind of rely upon to address this question. Over to you.
Well, let me stick with you for another minute, Atonu, and ask, you mentioned the need for policy approaches to address impacts. What do you think is needed?
Yeah, so but again, I'll build up on Bangladesh, my experience with Bangladesh, because I know the context a little bit. And so let me start with what has been done, or what are the policies that the government have tried. So, and those are in some sense pretty generic. So we have a social safety net program, and that was extended during the pandemic. So, and that included a food distribution system, that included opening up different channels to provide direct ration to vulnerable population. So that's, I think, one thing that kind of comes naturally. The main problem there is the distribution, and that has also come up in many different contexts, that if you don't have a robust distribution system and proper selection procedure to identify people who are vulnerable, they suffer from. So there's a policy aspect of it, and there's also implementation aspect of it, and I think we need to focus on both. Second thing is providing access to credit, which the government and different policymakers have done. Third thing is, I think becomes a little bit trickier, which is providing us stable employment opportunities for vulnerable population. And I think that's tricky because we, at least in the first year of the pandemic, there was a debate around life versus livelihood, right? And we don't hear that often anymore. But I think stable access to an employment opportunity is something it's more challenging, but at the same time, I think that's something that we need to think about. And I think that's where not only the public sector, I think the private sector, the employers also need to play a very big role. So I'll stop there.
Great, thank you for that. We have a question in the Q&A from Hung Tan. To improve food security, is it better to provide unconditional cash transfers instead of food aid, or the other way around? So I think, Cecilia, you're the one who mentioned cash transfers. Could you speak to that?
Sure. And I'm going to build on what Atonu said. It really depends on the context. So what's appropriate in that setting? So we know that cash transfers work, and they can increase access to safe and nutritious and affordable foods. But there are other ways to do it. Sometimes it depends on how much access there is to the people who need it. We saw during COVID in some countries, informal workers weren't offered some of the access to some of the programs. So I don't see it as an either or. I think the evidence really shows that it depends on context. And I think we also have to acknowledge these programs are expensive. Governments initiated a lot of social protection programs during COVID. And now there's continuing crises. Some of these countries are suffering from climate events or conflicts. And now the effects of the Ukraine crises are impacting costs and will further exacerbate this problem when households, governments are still reeling from it. So there's a question about the extent of what can be possible. And we really call on international associations and donors to help in this crisis.
Great, thank you for that, Cecilia. Brunah, another question for you. In what ways do you think race intersected with gender to lead to some of the impacts you discussed?
Yes, for example, in the rural communities, we did research. They are called quilombolas, which are people who are descendants of slaves. And these communities, they are very far from the cities. They are very isolated. But there are some, like, for example, there is a monoculture of bananas very close to one of the communities where we worked. And this banana monoculture has a lot of access to water. There is no problem in making water go to this banana plantation, but the community don't have access to water, and it's just right beside it. So we see that they suffer racism from it's historically a violation of human rights they are suffering, because the city hall can make water go to nearby sites, but they say that they are not able to bring water to this community, and we don't see another way to explain this. And women are the leaders of this community, because most men, they migrate to find jobs. So the women stay in the communities, and they are the ones that go after government to ask for water, and they are not heard. They are never heard. This goes on for decades. So we see that it's not just about gender, it's also about race.
I'm wondering, Brunah, you'd mentioned some of the advocacy work, policy work that had come out of your research in Belo Horizonte. Have you found a way to make race a part of any of those discussions? And has that been helpful at all in moving forward any action in any of the sites that you've been working in?
Yes, here in Belo Horizonte, Black women and solo mothers, they are the ones that are the most vulnerable. They are also the ones that are the most vulnerable because of the historical inequalities they suffer. So we are also trying to help these women to be heard by the government, like the question, what is better? Like Cecilia said, you need to know the context, and to know the context, you need to talk with these leaderships, with these women, to see what works best, how they want public policy to be implemented, what is the best way. I think it's important to have this kind of meetings like the one we had.
Great, thank you. Let me ask another question to the whole panel. So the US has announced that it will hold its first food insecurity conference in 50 years. What do you want them to know about gender and food insecurity? Why don't we start with Cecilia and work our way back again?
Sure, I think it's a great sign that they're doing this, and the US has been a leader in food insecurity, along with the focus on gender. Canadian government has also. I think it's important to advocate to mitigate the disproportionate impact on women and girls. And as we developed in our analytic framework, it's important to address that gendered impact explicitly, so that should be part of any policy that's done. As we said, it could be difficult to measure and address, but it really needs to be included. Thank you.
Great, thank you. And Atonu?
Sure. I think maybe we can think about three things. So number one, going beyond the average. I think many of our discussion take place around average, and that hides the heterogeneity, and also, for example, vulnerability by different groups. There may be special variation within a country, within a nation. So I think that's important. Second thing, so there are certain things like history is repeating. So number one, conflicts. I think there was a complacency took place since early 90s, but many of the conflicts are kind of coming back. So that's something that we need to think about. The reason I'm mentioning that, I think how we future-proof food, I mean, that's kind of the basic need. I mean, that's a, even if we cannot ensure food access to proper food, I think it's a big failure as probably a humanity. So I think that is something important that we need to take stock of. For example, what are the emerging threats, and what are including for the climate change that will have a huge impact in future. Third thing is data, right? I mean, I think that's something that we need to keep in mind. I think we need to kind of build up data infrastructure so that we have access to timely data, identify areas and emerging issues so that we can react appropriately and more quickly. I think that's the third thing is also important, and there should be a kind of a collective effort to build up data infrastructure to address some of the emerging issues that we've been discussing.
Great, thank you. And Brunah.
Yes, just like to add that the importance of having women in decision making, and to value their knowledge and their expertise in this issue, in making public policy and decision making.
Absolutely. And final question for you, Cecilia, and then I'm going to ask everyone to help close out the webinar by saying a few final words. Oops, sorry, excuse me. So Cecilia, it's interesting to think about how underlying gender inequities exacerbate crises. Can you expand on this a bit?
Sure. I think it's important to look at it systematically, as we've done in our framework. That's when you understand that a COVID shock can hit everyone. So certainly we had the economic shock that affected everyone, but it's because of those gender inequities, it affected women and girls more. So understanding women had informal jobs, women lost them, were more likely to lose them. Women didn't have resources to back them up. Women have less social protection, legal protection. Women lose houses and businesses. So that inequity needs to be thought through systematically. And I want to acknowledge Rosemary's role in this, who has been both with your work and our work for standing together. The focus on a systematic approach and using evidence to really drive what we're thinking through, what our policy recommendations are, what our findings are.
Great, thank you. So why don't we give each of our speakers just a minute to make some final comments in order of presentation. So Atonu, followed by Brunah, and then Cecilia.
Again, thanks so much to the host and organizer for arranging this. I think personally, I gained a lot. I hope people who have listened and people who will listen to this will benefit from this gathering. I think, again, building up on something that Cecilia just mentioned, the systematic approach, I think how power and resources interact with each other is very important. There is a kind of persistent inequality, which is both a cause and effect of that unequal access to power and resources that we need to acknowledge. I think there was, again, the sense of complacency that both inter-country and within nation, different groups will naturally converge to a sense of security, which have proved to be not right. So those are the areas where we need to focus on the governance, the accountability, and transparency. I think these are somewhat cliched, and we've been discussing this for last, I don't know, since Second World War, 3 generations for already. But it seems like all those issues remain on the table, and we need to address those systematically and collectively to build more resilience toward shocks. The shocks that we have already faced, and unfortunately there are emerging threats from, say, climate and other areas that are coming up over next generation. So those are the areas I would say that we should be focusing on and work together to address. Over to you.
Great, thank you, Atonu, so much. Brunah?
Yes, just agreeing with Atonu and Cecilia that we need to think systematically and structural changes, not only food donations and assistantialism, but we need to change the structures that and guarantee autonomy for women to plant, to have income, to so they don't depend on donations. They need to have this autonomy. So we need to think about the structures that are underlying this problem, and to also thinking ways of changing these structures. Yeah.
Absolutely, and Cecilia?
I want to thank you. This is such an interesting event where we're looking at more structural approach as well as the evidence. And for standing together for nutrition's work, we were, as I put in the chat and followed up with Atonu, we don't have data yet. We have emerging evidence. The research that's coming out is really important, and it can help narrate our advocacy. So I want to put a plug in for advocacy. We're researchers here. Standing together is a group of researchers, but we can make policy impact. So Rosemary highlighted a couple of the policy briefs that we have. We have materials, we have briefs that can be shared, we have a social media kit. And I'd really encourage you all to really amplify this message. It's so urgent. And I really thank you for that.
Well, I think that's a perfect note to end on. So I am going to thank all of our attendees for coming and being a part of this webinar. Thank you to our speakers for sharing all of their research and their wonderful thoughts. We will make the slides available online, and the recording will be made available. Please also visit our website, take a look at the briefs that Rosemary has put links to in the chat, and join our gender and COVID working group. Thank you all for coming.
Thank you.
Thank you.
Thank you.